So, good evening everyone. I am Cassandra Tumanachi. So, ngayon, bago natin sisimulan yung ating discussion, don't forget to click the subscribe and follow button. Charo lang ganun. So, today, we'll be taking a closer look at the depressive disorder, so as defined in the DSM-5-TR. So, our focus will be on two specific types: substance medication-induced depressive disorder and depressive disorder due to another medical condition. So, ano nga ba yung depressive? So, depressive disorder are the complex mental health condition that go beyond just feeling sad. It is crucial to understand the different causes and how they're diagnosed. So, we'll be focusing on differential diagnosis, which means distinguishing between disorder with similar symptoms. So, we will explore how the substance use or other medical issues can directly trigger. We will explore how substance use or other medical issues can directly trigger depressions. So, ano nga ba yung substance medication? So, bago natin talakayin is konting overview lang din or about sa depressive disorder. Watch this video.
Everyone feels sad sometimes. It is a normal part of life. You might feel down after a bad day at work or when you miss a friend. This feeling usually goes away after a little while. But depression is different. It is more than just feeling sad for a short time. Depression is a serious medical condition. It affects how you feel, think, and act. It can make everyday tasks feel impossible, like getting out of bed going to work. The sadness doesn't just go away. It stays with you for weeks, months, or even longer, making it hard to enjoy things you once loved. Understanding depression is very important for our health. It is a real illness, just like diabetes or heart disease. It is not a sign of weakness. It is not something you can just snap out of. When someone has depression, their brain chemistry might be different. This illness can touch anyone, no matter their age, gender, background. Recognizing the signs is the first step toward getting help. It allows us to support our friends, family, and ourselves. Knowing what depression is helps us fight the stigma, encourages people to talk openly about mental health, which is as important as physical health. Depression comes in many forms. The big book doctors use is the DSM-5-TR. It lists many different types of depressive disorders. Most people have heard of major depressive disorder. But sometimes depression isn't standalone. It can be caused by other things in our lives and bodies.
Thank you. So, pupunta na tayo sa substance medication or induced depressive disorder. So, ano nga ba yun? So, substance medication-induced depressive disorder, this type of depressions occurs when depressive symptoms arise during or shortly after using a substance, during withdrawal, or after taking certain medication to diagnose it. So, we look for a significant and persistent depressed mood or loss of interest in activities. So, we also need evidence from the person's history, physical exam, or lab test that symptoms are linked to the substance or medication. So, it is important to ensure that these symptoms aren't better explained by another depressive disorder and don't occur only during delirium. So, we specify if the person has depressive features. Meeting the full criteria for depressive disorder, and substances and medication associated with depressive symptoms. So, many substances and medication can potentially induce depressive symptoms. Common substances include alcohol, stimulants during withdrawal, sedatives, cannabis, and uh, opioids. Medications such as corticosteroids, interferon alpha, estro, um, isotretinoin, some antihypertensives, and hormonal contraceptives can also be culprits. So it is important to remember that this isn't a complete list. So, and a thorough review of all medication is always necessary. So we have this example of case of Sarah. So Sarah is a 30-year-old who experiences depressive symptoms after stopping a long-term opioid use for chronic pain. So her symptoms include a persistent low mood, loss of interest, fatigue, and trouble concentrating. So she has no prior history of depression, and these symptoms started within a week of stopping the medicine opioids. So therefore, her diagnosis would be opioid-inducing depressive disorder with depressive features, moderate. This case highlights why it's important to consider substance use history when diagnosing depression. So this is the video, watch it.
Let's talk about a specific type of depression called substance or medication-induced depressive disorder. This name might sound complicated, but the idea is simple. It means that the feelings of depression, deep sadness, loss of interest, low energy, are a direct result of using or stopping a substance. This could be a medication prescribed by your doctor, an over-the-counter drug, a recreational drug. The substance itself triggers changes in the brain that lead to depressive symptoms. It's not a coincidence. The substance is the direct cause of the mood change. For a doctor to diagnose this, they need clear evidence. Symptoms must start during or soon after you begin the substance or during withdrawal. This timing is a key diagnostic clue. For example, starting a new medication and feeling very down a few weeks later could be connected. The doctor must rule out other depressive disorders that might explain the symptoms. The substance must be capable of causing these symptoms. Many substances can cause depression. Prescription examples: beta blockers, corticosteroids, prednisone, acne medications. Hormonal treatments like some birth control pills can affect mood for some people. Recreational examples: alcohol is a known depressant. Heavy or long-term use can lead to serious depression. Other drugs, opioid stimulants, when effects wear off, they can cause a crash and depressive feelings. Not everyone taking these substances will become depressed. Many people use them without problems. Bodies react differently. Personal biology, genetics, other health factors can influence response. Talk to your doctor if your mood changes after starting a new medication. They can help determine if there's a link and the best next step for your health. Let me tell you a story about a woman named Sarah. Sarah was a 45-year-old teacher who loved her job and enjoyed gardening on the weekends. A few months ago, her doctor prescribed a new medication to help control her high blood pressure. At first, everything seemed fine. The medication was working well for her blood pressure. But after about a month, Sarah started to feel different. She no longer felt excited to go to school and see her students. Her weekends were spent on the couch, not in her beloved garden. She felt a heavy sadness that she couldn't shake off. Sarah's family noticed the changes too. Her husband mentioned that she seemed tired all the time, wasn't smiling and wasn't laughing like she used to. She had trouble sleeping through the night and had lost her appetite. Sarah felt confused and guilty. She thought, "My life is good, why do I feel so terrible?" She didn't connect her feelings to the new medication, she just thought she was going through a rough patch. The feelings of worthlessness started to creep in, and she began to withdraw from her friends, making excuses not to see them. This was not the Sarah that she or her family knew. One day, during a follow-up appointment,
her doctor asked her how she was feeling overall.
Sarah hesitated, but then she decided to be honest. She described the deep sadness, the lack of energy, and how she had lost interest in everything she once enjoyed. The doctor listened carefully. He looked at her chart and noted that these symptoms started shortly after she began the new blood pressure medication.
He knew that this specific type of medication, a beta blocker, could sometimes cause depressive symptoms in a small number of patients.
This was the key piece of the puzzle.
The doctor explained the possible connection to Sarah. He suggested they try a different type of blood pressure medication that was less likely to cause these side effects.
Sarah felt a sense of relief. It wasn't just all in her head. There was a possible physical reason for her emotional pain. After switching medications, it took a few weeks, but Sarah slowly started to feel like herself again. Her energy returned, she started enjoying her garden, and the heavy cloud of sadness lifted. Sarah's story shows how a medication can directly cause depression and why telling your doctor about all your symptoms is so important.
Okay, thank you. So now we move to the next, the depressive disorder due to another medical condition. So this diagnosis applies when depression is directly caused by the physical effect of another medical condition. So the key criteria is include a noticeable and ongoing period of depressed mood or decreased interest in activities. So there should also be evidence from medical history, physical exam, or lab results that the depression is a direct result of the medical condition. So as with the previous disorder, it shouldn't be better explained by another mental disorder or occur only during delirium. So we also specify features like anxious distress, melancholic or untypical features, psychotic features, catatonia, peripartum, onset or seasonal patterns, and note the severity. So in medical condition associated with depressive symptoms, so many medical conditions can contribute to depressive symptoms. So these include neurological disorder like stroke, Parkinson's, multiple cirrhosis or sclerosis, and traumatic brain injury. So endocrine disorder such as hypo or hypothyroidism, Cushing syndrome, and Addison disease, so can also play a role. So additionally, cardiovascular disease, autoimmune disease, and cancer. So are significant factors. Again, so this list isn't exhaustive and a comprehensive medical evaluation. So we have this case of Robert example. So consider Robert is a 65-year-old man who shows depressive symptoms after a stroke. So his symptoms include a persistent low mood, fatigue, social withdrawal, and cognitive difficulties. His medical history confirms a recent stroke affecting his left frontal lobe, and the symptoms started within a month of the stroke. His diagnosis is depressive disorder due to stroke with depressive features moderate. So this case emphasizes the importance of considering neurological events when diagnosing depression. So watch the sample so para mas maintindihan nyo.
Category: Depressive disorder due to another medical condition. This is when depressive symptoms are the direct physiological result of a physical illness. Your body and mind are not separate, they are deeply connected. When your body is struggling with a medical problem, it can directly impact your brain's chemistry and functioning, leading to depression. This is different from feeling sad or worried because you have an illness. In this case, the illness itself is causing biological changes that triggered the depression. It's a physical consequence of the disease process. For a doctor to make this diagnosis, there must be strong evidence that the depression is a direct result of the medical condition. This means the depressive symptoms appeared after the medical condition began. The doctor will perform a thorough evaluation, physical exam, lab tests, review of your medical history. They need to confirm it's not just a psychological reaction but a direct biological effect. For example, some medical conditions can cause inflammation, hormonal changes. There is a long list of medical conditions that can cause depression. Neurological diseases are a common cause: Parkinson's disease, Huntington's disease, stroke, traumatic brain injury. Endocrine conditions involve hormones, hypothyroidism, Cushing's disease, autoimmune diseases like lupus, certain vitamin deficiencies. Understanding this connection changes the approach to treatment. If the medical condition is the root cause, standard antidepressants alone may not be enough. The underlying illness must be managed effectively. Treating the physical illness can improve or even resolve depressive symptoms. This highlights the importance of a holistic approach to healthcare, treating both mind and body. Distinguishing between substance-induced depression and depression from a medical illness is a critical task for any doctor. The health and well-being of the patient depend on getting this diagnosis right. The first and most important tool a doctor uses is a detailed conversation and history-taking. They will ask you very specific questions about when your symptoms started. Did the sadness begin after you started a new medication? Or did it appear after you were diagnosed with a new illness? Like a thyroid problem, Parkinson's disease. This timeline is the most powerful clue they have to work with. A doctor will conduct a thorough review of everything the patient is taking. This isn't just limited to prescription drugs, it includes over-the-counter medications. herbal supplements, vitamins, alcohol, illicit drugs. The doctor will compare the start date of each substance with the start date of the depressive symptoms. If a new medication was started a month before the depression began, that is a big red flag. On the other hand, if the person is not taking any new or suspicious substances, the doctor will look more closely at their physical health for an answer. To check for a medical cause, the doctor will perform a complete physical examination. They will look for signs of different illnesses. They will also likely order laboratory tests. Blood tests can check for things like thyroid problems, vitamin B12 deficiency, hormonal imbalances. In some cases, if a neurological condition is suspected, they might even order brain imaging like an MRI scan. The goal is to find physical evidence that can explain the depression. If the tests reveal a medical condition known to cause depression, that becomes the most likely explanation. Ultimately, making the right diagnosis is a process of elimination and careful investigation. The doctor acts like a detective, gathering clues from the patient's story, medication list, physical exam, and lab results. Is there a substance that could be the culprit? If yes, that is a strong possibility. Is there a medical illness that explains the symptoms? If so, that is another strong lead. The doctor must rule out a primary depressive disorder, like major depression, which might just happen to occur at the same time. This careful, step-by-step process ensures that the treatment plan targets the true root cause of the person's suffering. The good news is both substance-induced depression and depression due to a medical condition are treatable. The key is that the treatment must target the underlying cause. For substance or medication-induced depressive disorder, the primary treatment is often straightforward. Stop the substance. Change the substance. Always do this under a doctor's supervision. If the depression is caused by a necessary prescription medication, the doctor can often find an alternative without the same side effect. Once the offending substance is removed, symptoms often improve or disappear. For depressive disorder, due to another medical condition, treatment focuses on managing the physical illness. As in David's story, treating hypothyroidism resolved his depression. If the cause is a stroke, rehabilitation and support are key. If it's a vitamin deficiency, supplements are the answer. Addressing the root medical problem often improves depressive symptoms. Sometimes some depressive symptoms remain even after treating the medical condition. In those cases, a doctor might recommend psychotherapy, or talk therapy, or an antidepressant medication to manage mood symptoms. Regardless of cause, support is important. Talk therapy can be incredibly helpful. It provides a safe space to talk and learn coping strategies. Therapy helps process medication or illness-related experiences and lingering feelings. Support from family and friends is vital. Having people who understand and encourage you makes a huge difference. Remember, asking for help is a sign of strength. Here are the key takeaways. First, depression is real and treatable, and it comes in many forms. Second, pay attention to your mood after new medications or medical diagnoses. Your whole story helps them find the right answer. And finally, there is always hope. Identifying the correct cause lets doctors create a plan to bring you back to health and happiness. Your mental health is essential. Understanding its connection to your physical health is the first step to caring for your whole self.
Okay, thank you. So, we will now move to the differential diagnosis. So, to differentiate between these disorders, consider a temporal relationship. So, when did the depressive symptoms start in relation to substance use, medication, or the medical condition? And then also assess the severity of the symptoms. So, are they disproportionate to what's expected from the substance, medication, or medical condition alone? So, it is crucial to exclude other disorder that might be explain the symptoms. A thorough medical evaluation and detailed substance use history are essential. So, for the treatment and considerations, for substance medication-induced depressive disorder, the primary approach is to address the underlying substance use or medication. So supportive therapy or antidepressants can be considered if symptoms persist after stopping the substance or changing the medication. So for depressive disorder, due to another medical condition, the focus is on treating the underlying medical conditions. Antidepressants, psychotherapy, or a combination maybe also be helpful. So consultation with specialists like neurologists or endocrinologists is often necessary. So keep in mind that treatment should always be tailored to the individual's specific needs. So in summary, the substance medication induced depressive disorder and the depressive disorder due to another medical conditions are distinct categories. So, in the DSM-5, accurate diagnosis relies on careful assessment of when symptoms started, how severe they are, and the person's medical history. So, treatment involves addressing the root cause and managing the depressive symptoms. Collaborations between different healthcare professionals is often essential for the best care possible. So, that's all. Thank you.